Nashua.
Oh, we gotta say it's okay to record, and I gotta plug in my laptop before it dies. It's only at 34% today.
Oh.
Right now.
Oh, geez.
That's not a good idea. We'll plug
Yeah,
her
the
in.
video will.
Dear.
And the video will suck up that remaining power.
Pembroke. Nice. All right. Well, I think we should start.
I agree.
I guess he'll come in late. So let's start. I'm Sophie, and
I'm Colby.
we are here to speak to the great potential that comes from introducing the dental community to the disability community. And for years, we have fought hand in hand to make dental care more accessible and affordable. The advocacy groups, such as the task forces that come out of the New Hampshire Leadership Program, the New Hampshire Leadership Series, Able New Hampshire, people spreading the word to newspapers, and dedicated workers such as those who work for Northeast Dental, Delta Dental, who have opened up their practices to people with disabilities and have led with an open mind and an open heart and led by example. In July of 2022, Chris Sununu signed legislation to include dental care in Medicaid, which was a landmark in this fight for accessible care, but the fight is far from over. And that was only 3 years ago. Joe Shapiro, a New Hampshire representative at the time who sponsored this bill, said this of the signing: if you believe that healthcare is a human right and that oral health is an integral part of that, then it is really a good day for New Hampshire. So what we foresee coming from the joining of these communities is mutual support and respect for each other. We want to build strong communication and the ability to call upon one another for support. And I'll pass it off to Colby.
Yeah, so long before this bill came to pass, advocates from grassroots organizations and members of our community stepped up and shared their personal stories and facts about why Medicaid should be accepted by dental providers, and they shared these stories and information with local legislators, legislators, and news outlets. Dental professionals like these here tonight have paved the way by opening their practices to accept Medicaid from patients and change their practices to be more accessible. And we understand that people here tonight might be coming into the session with different perspectives and experiences when it comes to dental care and Medicaid. That's why we want tonight to be a conversation that welcomes all to speak up and ask any questions that you feel comfortable with, whether it's something you've been thinking for a while or something that you just learned tonight. Please feel free to ask your questions and even share your own experiences on this topic.
All right, without further ado, let's pass it along to Katie.
Okay. Hi, my name's Katie Phillips. I live in Dover, New Hampshire. I am 33 years old. I have been without a dentist for 5 years now. So my dentist used to cover Medicaid, and then when I was 26 years old, they called me and told me that they no longer took my Medicaid. And so I ended up not staying with that dentist because of my insurance not covering it. So I haven't had a dentist for 5 years now. And it's very important that dental offices are able to treat adults with different abilities.
Awesome. I want to take some time to just read a message from Shannon in the chat, that if you are 18 to 21, then they age out of insurance. Talking about aging out of insurance and not getting that care. And that is a really good point I wanted to share. Shannon, do you have anything else to say on that? But also, thank you so much, Katie,
You're welcome.
for your story. And I know you have to hop off soon, so if anyone else has any questions for Katie or anything,
I just have
please.
another thing
Yeah.
for Katie. I know you've done a lot of work recently talking to different people, lawmakers in our state, and even I think some on a national level. Do you want to talk about that at all a little bit? Kind of talking to them about dental topics?
Yes. So I did go to, so recently this past year, I think it was in the fall, this past fall, I went to a roundtable event in Manchester at the Manchester mental health office, and they were it was a roundtable with Senator Shaheen, Senator Maggie Hassan, and other doctors that deal with Medicaid, and we were all like basically talking about like how important it is that Medicaid doesn't get cut in the budget this year, because it helps people to get, the medical care that they need, and it also gives them the freedom to get the medicines that they need from their doctors and stuff like that.
Yeah, that's really cool, Katie, that you had those opportunities. And I would say too, I know you only have a few more minutes, but kind of, do you want to say too a little bit about kind of when you found out that you were kind of off for at 26, kind of is that
Yeah.
kind of when your kind of fight started to?
Yeah, so that's basically when my fight started, because like I wish that I wish that Dr. Lowe's office had told me when I was still 21 that they were only covering WellSense until I was 21, and it was very surprising to me that they called me up as soon as I had turned 26, and I was like, okay. I'm like, but I said, that's great, but I'm like, why are you calling me now? I'm like, I'm 26 years old. I'm going off of my parents' insurance, my dad's and my stepmother's family plan. I said, and you couldn't have told me this when I was still 21. So I said, how are you able to pay for it beyond that? So I was like, that didn't make any sense to me. So that's basically when my fight started, was when I was told that my dentist office no longer would be accepting my insurance.
And that's a fight that you've worked really hard for. And I know you participated in an educational training video and
Yes, I
other
did.
stuff. So you've been really active in this fight for a
Yes.
really long time. We have a question in the chat, but
Go
I
ahead.
think if you have any questions in the chat, I don't think this is one that maybe you can answer. So if you need to hop off, feel free to do so.
Pam said, my son has had Medicaid all his life this year. He has Medicare Medicaid because I turned 65. Can he still get dental coverage? I honestly don't know the answer to that, Pam, but I'm thinking that he can. I'm not sure, but maybe Dr. J or Dr. Joe can answer that.
Hi, Pam. If he qualifies for Medicaid, he does have the Medicaid dental benefit. And actually, what I can do is there is a link through New Hampshire DHHS that can help you check eligibility for it. So let me see if I can find it and I'll put it in the chat.
And this is Kelly. I'm on Medicare Advantage, and my Medicare Advantage does cover dental uh visits, but your dentist has to take it. If, like, say I go to Harbor Care and they take Medicare and Medicaid, and I live in Nashua, like I said in the chat, it was just my initials. But I used to go to a place called Sterling Smile, and they took my Medicare, but they didn't take Medicaid. And I was seeing them back before in 2019 when I testified in Concord about getting the dental bill passed, because when adults are developmentally disabled, this isn't true in every state, I'm sure, but when you turn 21, you lose your coverage for Medicaid, because Medicaid covers you till you're 21 when you're a kid. And then once you hit 21, you lose it. Or like Katie was saying, she was on her parents until 26. So then she lost it that particular year. She turned 26 and then it was like, nope, sorry, I don't take this insurance anymore. So it depends on whether your dentist takes it and then whether you're eligible, like Dr. J was saying. And if you look it up, like when I always ask my insurance company if if one of my providers quits or something like that, is who can I go to? Like what dentist can I go to? What therapist can I go to? What primary care doctor, that sort of thing. I ask them, and then I'm dual eligible, so I have Medicare and Medicaid, so I have to have them take both. So that's my long answer for that one.
All right. And I think we should, if we're good on this sort of panelist, we can move on to Kelly if you want to go next.
I also see Owen with his hand up.
Oh, okay.
Welcome Owen to.
Hi, Owen. Do you have any questions for any of us?
I was just thinking because I had something, because I went through Medicaid in sort of the Granite State Advantage piece.
Yes.
I was my my experience is more with vision, but when I found out about vision, it's talking with Alex between the difference between Medicaid and Medicare. It was
Yes.
we both went to the same vision company, but
Right.
there was one in where we both live in Dover,
Right.
and but it was only the one in Hampton that provided services for Medicaid, not Medicare. So I think
Right.
location is also a big one too, even if you
I'm
have the same
thinking,
company.
yeah, I'm thinking there's more dentists in Nashua that would take Medicaid/Medicare than in the North Country. But that's why it depends on where you live too, whether your dentist will take it or not, or whether any dentist take it, because Harbor Care is federally funded, so they have to take it. So that's why, since I've been going there, I haven't paid a penny out of pocket, and I go to the dentist 4 times a year to get my teeth cleaned and other things. If I have a cavity or needed an extraction, they'll do that sort of thing. It's good to know
Looking-
what Medicaid covers under the New Hampshire
Yeah.
Smiles program too.
Yeah.
Where is
You
it?
wouldn't happen to know for more complicated, like if the reason dental hygiene sort of goes down is due to some sort of like digestional issue where teeth care is less in there. Do you happen to know offhand how
I would not
easy it is
say,
to mix those sort of both Medicaid care together?
It's dual eligible. I'm not a dental hygienist, so I can't really advise you on how to keep your teeth clean or anything like that. I guess that's what I would say. It's
I'm more,
complicated if you have both Medicare and Medicaid.
yeah, I more
Find a
meant like,
dentist or a doctor or anything like that.
yeah. Okay. I just know the split between dental and medical is kind of makes some of that stuff complicated. So just
Right, it does. Mara, you have your hand raised. Do you have a question for anyone specific on the panel?
Actually, I had a question for you. I wanted to know where you're going because right now we are having a little bit of trouble finding dentists that take Medicaid.
Are you talking about Nashua or are you talking about
Nashua, please. Yes.
Harbor Care Health and Wellness? They have one dentist and 3 chairs, and there may be a wait list to get. I've been going
I
there
think
since
so. Yeah.
2024, and I actually went to the dental clinic 10 years ago when they first started it. But then I went to Sterling Smiles, and they do take United Healthcare and they take WellSense Medicare Advantage, but they don't take Medicaid.
Okay.
If you have clients that have Medicaid, I would tell them or advise them or maybe help them look on your computer, because I know you guys have computers,
Yeah.
and then to look and see who's taking new patients and who takes it. Because sometimes they may not be taking new patients, even if they take Medicaid.
Yeah, and that's the
Then,
problem that I'm running into, especially when clients need sedation. I cannot find anybody, really.
right, if you need sedation to get your teeth cleaned, that would be even more
Mhm.
complicated and harder, I would
is.
think, because I just go in there and say, clean my teeth. I don't need sedation or anything like that. I just
Yeah.
grin and bear it. If it hurts, it hurts. It's my fault because I didn't brush my teeth well enough.
And the Dr. J just put a couple links on in the chat of New Hampshire Easy Gateway to Services and Find a Dentist DentaQuest.
Yeah, that's
So
always handy, I would imagine. I haven't really had to look for a dentist. Like I said, I have mine in Nashua, and I'm fortunate that I don't know if I just went to them, I stopped going to them, and I came back to them because I guess they didn't take my United Healthcare. So I didn't take my Medicare, so I stopped going there because it would be too much out of pocket. So yeah.
and then Jennifer says, does the portal by DentalQuest take into Medicaid, Medicare, and other third-party providers? And that's a question probably for Jay.
Yep. So DentaQuest portal just takes the adult Medicaid, so 21 and over. So only the adult Medicaid program is the only thing that we administer for the state of New Hampshire.
Right, it wouldn't say Medicare. You have to contact your Medicare Advantage plan or Medicare. Straight Medicare doesn't cover anything for dental.
Right. And we also
Nothing.
don't administer the child program under 21, just the adult.
Right. Right, that makes sense. If you have a child under 21, it's a different resource for you.
All right.
Okay, thank you.
Yeah, this is a really good conversation. But I really want to hear Kelly's story because she's been so
That's
vital.
why I'm gonna play
in
my
this fight.
video. It's on the Able site. It's a short one. Basically, I'll tell you my story. How I was in leadership series and I graduated in 2018. We're talking about dentists and dental care, and someone else, Danielle Poirier, said, I'm over 21. We were both over 21. I'm 58 now, but she said, why can't I go to the dentist and why does Medicare not pay for my dental visits? Because she was over 21. And I'm like, I don't know. That's a good question because I lived in Illinois, Virginia, and now New Hampshire. But we looked into it with the help of ABLE and the ABLE Nashua chapter, which we used to have. And we found out it was illegal for people to over 21 to get dental benefits under Medicaid. So we had to change the law, and I had to go to Concord in 2019 and testify. Like Sophie said, it didn't pass in 2019. It didn't pass in 2020. It didn't pass in 2021. 2022, it finally passed. But now I think the fight now is getting dentists to take the insurance so that no matter where you live in the state. If Owen needs to go to the dentist in Dover, or Katie needs to go in Dover, they can go in Dover. They don't have to go to Hampton or Timbuktu or wherever to find a dentist. I can go anywhere in Nashua that I want to, and like some people are saying, it's hard to find a dentist that will take Medicaid. If you need sedation, maybe you're on the autism spectrum and you just can't stand all the loud noises of the dentist cleaning your teeth and the bright lights or whatever. So that's the next hurdle, is getting dentists to take the benefit. Because I know at Sterling Smiles, I asked her if she was going to take the adult dental benefit, and she said no, but she takes it for kids. So she knows the benefit of, taking it, but she doesn't take it for adults. So I didn't tell her because I didn't want to burn any bridges, but I left her practice. And like I said, I go to Harvard Care. I didn't want to burn any bridges, but I just had my medical records transferred. And I'm boycotting her because she doesn't take the dental benefit, but I didn't tell her that. So it's kind of, I guess it's not really that good of a boycott if I didn't say, hey, I'm not going to you because you don't take my Medicaid. And it was expensive to pay everything that Medicaid didn't pay for because she didn't take it to go to that dentist. I couldn't afford to go to that dentist because it's too expensive. So that was, and then I guess, I don't know, if you go to, I'm sure it's got to be somewhere on the web, me testifying in Concord, my 3-minute speech or 2-minute speech of me testifying and saying my name is so and so and this is important, and a lot of other people testified. I'm not saying that they did it because of me. A lot of other people were in the same battle as I was, trying to get it passed, talking to their legislators, saying we need dental care. The dental care is not separate from the body. It's, it's whole health and that sort of thing. And the benefits of going to the dentist, like, and getting your teeth cleaned. Maybe, you won't get this or that or the other thing. And like some people, like I don't floss my teeth. So I go to the dentist more often and I take psychiatric meds, which dries my mouth out. So therefore I have to go to the dentist more often, that sort of thing. So it's important, obviously. I'm sure you've heard it before, to go to the dentist, every 6 months, they say, but I go every 3, and my dentist understands that. But she's the only dentist in there. And then one time, I guess they had the clinic open, and then she was pregnant. I saw her and I was like, uh-oh, she's pregnant. So they closed down the clinic for like 6 months to a year because they only had one dentist, until she came back and started up the practice again. I was like, oh no, female dentist, great. I was like, but originally it was started by a male dentist. I don't remember his name, but that dental clinic has been there at least 10 years. It's been there a long time. So I guess, does anybody have any other questions?
I do. I wanted to know sort of what was it
Okay.
like testifying? And
Well,
what kind of questions did you answer?
they didn't ask any questions that I remember. I just testified, and I basically told them my story, that I lived in Nashua, and that I couldn't afford to go to the dentist because at the time I had Medicare, which have had Medicare since 2000, but the being that there was no Medicaid dental benefit, I wanted them to pass it. And then they, like I said, they did pass it. I don't remember them asking me any questions, but I actually went on TV, Nashua Public Television or Community Television, with Senator Avard, and I did my advocacy to get it passed. But like I said, the fight isn't over because we don't have enough dentists that take it right now in this state.
Mhm.
If you look at the number of dentists that take it for the entire state, it's not enough.
Mhm.
I don't remember them asking me questions. They just wanted you to keep it, like Kathy knows, because she's testified on bills before. Keep it short, sweet, to 2 minutes, that kind of thing.
Mhm. That makes a lot of sense.
Yeah, I see Megan joined us. She's on the Dental Health Coalition. I'm not really on it, but I guess I did the early work, and then I just decided to take it easy, I guess. Once it got passed, it was like, oh, okay, now what?
It was definitely a landmark, and it's sort of, especially with advocacy burnout. Like,
Yeah,
you,
right. Well, actually, I worked at Marshall's for 12 years, and one lady said, you should move to Massachusetts because Massachusetts had a adult dental benefit before we did. I was like, I have my sister Sean lives in Londonderry. My sister Dawn lives in Somersworth. It's not that close to me, but I don't want to have to move out of state just to get a dental benefit. No, that's not what I'm willing to do. I'm willing to testify to get it passed. I'm not willing to move out of state. So,
mhm.
yeah.
And a fight like this is a marathon, not a sprint.
No,
Like,
it's not a sprint at all. It's a marathon to get dentists to take it. And it doesn't, I can say this not as a dentist, but I'm sure there's dentists on here. It doesn't make sense financially to take the dental benefit because the Medicaid rates are too low. And then we went like 15 years before they raised them. And then they're like, oh, let's just get rid of Medicaid. Let's just cut 3% off the Medicaid rate. And then they're not going to do that
Mhm.
now. But I don't know what's going to come down. This may sound silly, but on the federal front, as far as cutting Medicaid, SNAP, fuel assistance, those types of things, I don't know what the future holds.
mhm. And I just wanted to mention through Kristen, because she's personally helped me raise my confidence in my advocacy.
That's good.
That we were talking before this, that they want to hear people's personal stories. They want to
Yes,
hear
that was my
people.
personal story as an adult with an intellectual disability that wants just to go to the dentist and not pay an arm and a leg. Because Medicare does cover, I have a Medicare Advantage plan. It does cover some things, but without Medicaid, because Medicare only covers, even for dental, it's only like 80%. And for mental health care, which there's no parity in mental health care, it's only 50%. So I want to work on mental health, of course. I'm on the mental health task force. I don't know how we're gonna fix mental health. It's a different story. We're talking about dental health today, though.
But but in terms of the testifying, it's just so important for us to get our voices out here and for advocates to work with dentists
about public speaking. I know some people are, but I'm used to it because when I lived in Illinois, which I did live in Illinois, I remember going to a budget hearing and telling them not to cut mental health care. Even it was like the 501c3 board or something, and I even did that. And then this budget hearing, this year, I went to the budget hearing to tell them not to cut this and that. I didn't really speak, but I just listened to other people's testimony. But yeah, it was interesting to listen to other people say, don't cut this or don't cut that. And it made sense what they're saying.
Yeah, Owen has a question real quick.
Thank you. Yeah, no, with all the talk about dentists, I think there have been, I've noticed that there are some dental buses that are going around, mobile clinics, and I know that at least DentaQuest has some, but I've noticed that those are sort of Concord, Portsmouth, Concord, Nashua sort of area, but there's one that stops in Dover that I know of, and I know that there's one and I've done a little bit of research on it, and it seems to also do Rochester and Portsmouth too.
I would say that I shouldn't have to rely on a dental bus coming to my area once a year.
I know,
It's
but I
good that
meant
they're
more
doing
like
it,
for
but
us in the meantime. I'm wondering
right.
if focusing on making sure that if they do have those mobile buses, they take our insurance.
Yeah, I don't know if they would. You'd have to like look into when they're coming to your area and get an appointment. It's probably hard to get an appointment because I imagine there's a high demand for that and only so many dentists that they can fit on those mobile buses and the lovely chairs that they have. I've never been on a bus for
I'm
medical
curious.
care.
I may
dental or
check it out.
otherwise.
So I want to go to Dr. J.
Sorry, I didn't know how to raise my hand with Zoom. I was
Yeah,
trying
no
to-
worries. That's totally fine.
No worries. So I wanted to talk about the mobile dental vans or the mobile buses. So we
Sure.
partner with a group called Solvere, and actually, they come more than once a year. We actually try to have them come at least once a month, or at least for a weekend per month. And the hope being is they go to areas where there is a gap, where there's not a lot of dentists who are taking adult Medicaid, and even if they are, maybe their office is full at their capacity. So
Mhm.
with Solvere, they go to these areas and they will actually, you'll see them on a regular basis, and they're able to do all of the care that, or just about all of the care that's covered by the adult Medicaid benefit. And when I hear dental bus, I worked on one at Harbor Care actually when I first became a
Mm.
dentist. And I think about, those old like Winnebagos that were kind of dated, but these units, they're actually kind of state of the art. They've got x-rays, they have a hygienist, they have dentists. And really they want to make it so that it feels like this is your dentist that you go to regularly and you see not just once a year. And it does look
Mhm.
like
That's
Jennifer put
good.
in the link for scheduling a appointment. So we try to make it easy to schedule with them as well.
Mhm.
And then we
Yeah,
also
that's
try to
good.
share flyers for when they're going to be in certain areas of town. Um, Joe or Tracy, who works at Northeast Delta Dental, is there anything else you wanted to add? Since we
I
work
love
together very
flyers.
hard on getting these mobile dental clinics to areas where people can utilize them.
Well, I think they're going to be part of the long-term strategy
Mhm.
Absolutely.
for provider networks.
I'll keep my eyes out for them. There's one that goes to the library. It's not a dental clinic, but it's a mobile type, like blood pressure testing and vaccines and that sort of thing. It's like they're every single Wednesday. Oh, Kathy, you have a question
Yeah.
or a comment? You're on mute. I want to hear from Kathy.
Yeah. We'll just give her a second.
Yep.
You need to unmute, Kathy. You can't hear you.
Oh, yeah.
There you
It
are.
took me a minute to get the whole thing where I needed to go. Well, I was concerned about those buses because I'm like, are they big enough for wheelchairs, right? And
Mm.
this is what I was told. This is really cool, you guys. That they used to be like, bus, like trailers or whatever that big race cars would be carried around in, and then converted to these offices. So I guess they're like pretty huge, and so I hope I get to see one pretty soon because it would be like a cool adventure. So I'm in
Yeah.
the Nova area. Well, I'm in the Summersworth area. So if anybody has a schedule of when they're they're near me, I would love to go see one of these buses.
Yeah, it is definitely a challenge when you have to walk onto a bus for a lot of our community, and I
But I
think
was told that you can get on it if you're in a wheelchair. So is that
you
true?
can.
I would think that would be standard, but I'm not sure having never been on a bus that's for dental
Right.
care or medical, like I said.
Yeah, could you shed
The
some
ADA
light
would
on that,
require that, wouldn't
Jay?
it?
So I
What?
believe they are wheelchair accessible, but I don't have confirmation. Tracy or Joe, are you familiar? Maybe some of their units are, some are not.
I'm not 100% positive, but I'm going to take that question back to Solvere and I can get back to this group.
Yeah,
Yeah,
Awesome.
that would be way cool. I'd like to see it.
yeah.
No,
And they
that-
are, once inside, they are roomy. And you don't even know that you're in a mobile clinic. It looks like a normal
Mhm.
dental. There's even a waiting area. But Tracy will certainly take that one back about wheelchair accessible getting onto it.
will do.
Yeah, and I want to be mindful of time. Dr. J, do you want to present your professional insights and sort of how you sort of came onto this journey and stuff like that?
Sure. So my name's Dr. Jay Millette. I just go by Dr. J. And my entire practice has been in New Hampshire. When I graduated dental school, I worked at Harbor Care, which Kelly had shared. I worked at the federally qualified health center, and I actually worked on a mobile clinic there. From there, and that's in Nashua, I moved on to work part-time at a private practice in Nashua with my wife, who's also a dentist, and then also up at Concord Hospital. They have a dental clinic where they treat people without insurance because this was before the adult Medicaid benefit. And it was only for people whose doctor was also at the Family Health Center in Concord. But my whole practice has been dedicated to public health dentistry, which is treating people without insurance, people who are underinsured, people who are vulnerable, working with people with disabilities. I have quite a bit of experience just in working at the federally qualified health center in private practice and also at Concord Hospital. We saw quite a large population of people with acquired or developmental disabilities while we were there, as well as people who come from the refugee population, people who are referred to us through mental health services. So I loved public health dentistry so much that I eventually went back and got my master's in public health in epidemiology. And then from there, I actually ended up getting lucky, being at the right place at the right time, and joining DentaQuest 3 years ago, right before the adult Medicaid benefit went live. So, as somebody who had always worked in New Hampshire and treated adults who would qualify for adult Medicaid, but there was never a benefit, I was so excited to be, at the ground level helping to build this out and help, work with Northeast Delta Dental and New Hampshire DHHS to advise and try to help get this policy to a place where it could help as many people as possible. So I've been doing that since October of 2022, shortly after the bill was signed. And it's just been so exciting to work with Able, to work with Northeast Delta Dental, with DHHS to kind of continue to add on to this benefit. A lot of the things that people have mentioned, which have been the hurdles, they're all true and they're all things that we've been working on. And each and every day it gets a little bit better. When the plan went live in April 1st of 2023, I think there were about 60 dentists who were signed on at that point. As of last month, there was 190. So continuing to slowly get that number up. There are areas where we do have quite a few dentists that take it, and these are kind of in your urban areas like Nashua and Manchester, Concord. It gets harder in the North Country, and it's not just that because there's not dentists there who want to take it. It's just there's not a lot of dentists in some of these areas. So we've tried to come up with creative solutions, and one of those things we've already talked about with Solvair and the mobile clinics, and using that as a regular solution where, again, it's not just once a year, but several times a month, and making sure they're coming continuously. A lot of people here know Dr. Sarah Finney, who recently retired, but the dental director for DHHS. And me and Dr. Joe Arante have been so lucky to work closely with her. And we met regularly to talk about how can we expand these benefits. Some of those things that we were able to do is for people with disabilities who fall under the qualified waiver programs, increasing the amount of cleanings they can get. So people like Kelly who mentioned, she goes up to 4 times a year, they could get that number of cleanings. We also have a care management team that for those who qualify based on medical complexities, or they have different barriers to care, they can work with our care management and case management team to help them get a dentist that maybe takes their insurance, but also maybe they have anesthesia. We talked earlier about people who like anesthesia just because the sensory overload of being in a dental chair. I'm a dentist myself. I don't like when I sit in that chair and hear the noises and the smells and all those things. My wife is my dentist too, so she kind of doesn't take it easy on me. But one of the things that we worked on, and with the help of this task force that I'm really excited about, and it just went live May 1st, is we helped introduce a new dental code that dentists can bill out. And that code is the number for dentists is D9997. And what that code is, it's called Dental Case Management for Patients with Special Healthcare Needs. And for about 6 or 7 months, we talked with this group and we talked with dentists, we talked with Medicaid in other states to say, how do you reimburse dentists who take on patients with disabilities? And maybe it just takes a little bit more time or a little bit more resources to understand, you know, what is it that I could be doing for these patients with disabilities to make their time in the chair more comfortable, more efficient, to spend a little bit more time to understand what kinds of things can I be doing to make you feel more comfortable. And as a dentist, I was taught that's how you should treat everyone in your practice. You know, people with intellectual or developmental disabilities are no different. And that's how I treated everyone in my practice. So with this new code for those who are already treating patients with disabilities, we're hoping this is something that they see and they say, great, you know, I'm already treating patients with disabilities. I can now bill this code. They can bill it up to 5 times a year. They can get paid $100 every time they bill it, up to 5 times, so up to $500. And it doesn't count against the $1,500 maximum that patients have for their Medicaid. So if you know you have $1,500, that can get you your exam, your cleaning, some fillings, extractions, things like that. And it's nice to know that the $500 that goes towards just the extra time or resources or modifications dentists need to use, or even their office and staff, it won't count against that. Some examples of things that this might mean for a dentist is taking that extra time. So when you come in for an office, maybe it's your first time there. Maybe they don't get to do the full exam and x-rays and cleanings, but they can still bill Medicaid for that extra time where it just took to get to meet you. Understand what they can do to make you feel comfortable. You know, if you're getting a procedure that, you know, the dentist says, well, maybe that will be 20 minutes, but it takes a little bit of time for you to get comfortable in the chair, or maybe, you know, get what you need to be settled and feel like you're in a good place at the dentist. That extra time, they can help bill out this code. So this is something we just, again, it went live on May 1st, so it's been just over a month. We've already heard quite a bit from dentists how excited they are about this. People are already billing it. And I actually just got some pictures recently from a provider. I didn't get their permission to share it here, unfortunately, but it was from a dentist who's in the network in the Lakes region, and they sent a picture of them working on a patient with who was in a wheelchair, and you know they were able to treat them in the wheelchair, not necessarily in the dental chair. But they said, we're so happy to use this code because it allows us to take the time and treat this patient in their wheelchair, but give them all the services that they need. So we're really excited about it. It's something that we're going to continue to share with the network, and continue to monitor how it's being utilized. But we're hoping that that is an incentive for dentists who are probably already treating, you know, patients with disabilities to take them on, provide more services, and maybe even open up their panel and see more patients with disabilities. So New Hampshire is the first state that covers this code this way. There are some other states that cover it just one time. They'll only pay it the first time you're seen by a dentist. So we're hoping by seeing it, and I did see the question, it's 5 times per year per provider. So if you're seeing your your everyday dentist who does your cleanings or your fillings, they can bill it 5 times. But if they refer it to like an oral surgeon, who is one of the specialists that we have, they can also bill it as well because it's per provider or location. So again, brand new, but we wouldn't be able to do it without ABLE and this task force and the partnership with DentaQuest and Northeast Delta Dental and DHHS, because we were all working really hard to get this passed and specifically to increase access to care for people with disabilities. A lot of the other things that you mentioned about getting more dentists to take it, it's something that we all work together to try to continue to grow the network. Someone mentioned fees and the Medicaid fees, and it is true that Medicaid fees are less than commercial insurance, but we continue to have conversations. There's a lot of moving parts when it comes into the fees and how things are reimbursed at the federal and the state level. But you know, I think we have a really great team between DentaQuest, Northeast Delta Dental, and DHHS who are trying to advocate for these changes. But as everyone knows who is working and getting this bill passed back in 2022, these things take time. And luckily, there's lots of people who really care and whose hearts are in the right place. And you know, we have such great partnerships that we continue to advocate and try to move this forward as time moves on. So that's all I have.
Awesome.
As far as other things, there's transportation services and all sorts of things like that are available as well.
Right.
Kathy has a question.
Two quick ones. Where is your office?
My office?
Yeah.
My office is right here in Massachusetts right now. But
Oh, good.
previously I worked at Harbor Care in New Hampshire. I also worked at a private practice that doesn't take Medicaid in Nashua and Hudson, but then also at Concord Hospital, their family health clinic. Where if you see a primary care physician there at their family health clinic, you're eligible to see in their dental clinic. But their dental clinic is also very small, just one provider since I left about 4 or 5 years ago now.
I have a question. Do you know that if anybody in Somersworth takes it, like at Avis Goodwin, do they take the Medicaid dental benefit for adults?
I'm not
one-
sure, but that's something I'd be able to take back if you put their name in the chat.
Yeah,
Avis
that would be really nice to know.
Yeah, my sister lives in Somersworth and that's where she goes. And I'm not sure if she goes to the dentist there, but I do remember them having, I used to go there too because I did live in Rochester, but I was just curious.
Yeah, it sounds like you
I
see Dr. Gupta now at Harbor Care, Dr. Neha, and she's a
Yeah,
great.
You know,
Dr.
it's
Neha.
really
She's the
hard to
only
get
dentist. She
dental
cleans my
care now.
teeth.
Yeah, she's great.
Yeah.
I wanted to tell you to give yourself a little more credit. It's a little more than being in the right place at the right time. You are such a great advocate for public health. I've learned so much from you.
Well, thank you.
And it's just so nice and hearing about where that love started and how early on in your career you very intentionally included our community in your practice
Thank you.
is really like,
This is what I love to do, and
yeah.
it's one of
I
those
have a
things that as
question,
Thank
Dr.
you.
J. Could you explain a little bit about federally funded clinics, like how they work and why they take Medicaid dental benefit? Because you
Sure.
have worked at Harbor.
Yeah, I have about a 20,000 square foot view because when I worked there, they said, you don't have to worry about that stuff, just focus on the patients. But essentially, when it's federally funded, they get, a match from the federal government to help pay for some of the services because oftentimes they're doing these, they're taking lower Medicaid rates. And actually, even before there was an adult Medicaid benefit, usually they did something like a sliding scale based on what your income was. So they
They
are
still
able
do
to
have
take.
a sliding scale now, but I just
Yeah,
never pay anything.
yeah. So and they're able to do that. They're able to, take less, lower fees because that they have a match from the federal government that helps them to treat people who are underinsured or more vulnerable.
Yeah, I love federally funded places.
Yeah, but I think it's a real like you're such a it's a testament to how open and dedicated to this work you are that Kathy was like, "Where are you?"
Yeah.
Kathy wants to
I
see
know.
you, but I don't know if she wants to go to mass.
It's funny, I'm able to do some volunteer dental work, but this keeps me so busy. And Tracy and Joe can attest, we're on lots of calls with each other and with the state, and it really is, more than a full-time job to try to keep moving things forward and constantly evaluating how things are going. And we know that there's room for improvement, especially with building the network. So it's just one of those things we're still committed to do everything we can until we have as many dentists as possible who are able to take this. And there are things outside of dentist control. Inflation, and has hit dental offices hard, and there's a workforce shortage. Right before I came to DentaQuest, I was doing my own patients' cleanings because I didn't have a hygienist after COVID.
Yeah.
So right now there are offices that take it, but they're at capacity. They say it takes me, 9 months to get someone in for their 6-month cleaning. So it's really difficult right now. So it's one of those things
Right.
that we're continuing to have conversations with and seeing ways that we can help. But it's a marathon, not a sprint. I think Sophie had um, but there's lots of really truly, and it's not just me, there's lots of dentists in network who are truly dedicated and a lot of great people that work with the state and Northeast Delta Dental and us. So
I think my dentist is dedicated because I guess I can say this. She's from India. She's not born in the States. So she kind of comes from my I would imagine being that she's a dentist, she had to have some sort of privilege to go to dental school, but she's not like out for the money, like, oh, I gotta go to
Yeah.
Boston and be in private practice and make the big bucks. She's
I-
working at Harbor Care.
I can tell you your dentist is committed because she calls me on a regular basis and gives me feedback, tells me what's working, what's not working. So there are lots of dentists like that in the
Yes.
state, and they want to see this succeed. And it's gotten, busier, and we're seeing lots of patients. There's lots of claims and things coming through since we started.
Yes.
So things are moving. It just takes time to build up momentum.
Yes, I would like to say that I was with United Healthcare and they said, well, it was 1,500. They said, we're going to give you 750. I said, no, you're not. So I'm with a different company, but $1,500 in the dental world goes really fast.
Right.
Yeah.
And that's one of
Oh,
those things,
wow.
the way the
I
bill
had
was
a,
legislated.
I had a molar pulled and that's probably pretty expensive
Yeah.
because
Yeah,
I was weird.
yeah, can we I just want to keep time and keep in mind people's time, and we have a Q&A section at the end where we can go into more depth, but I want to introduce Dr. Joe. He's taught me again so much about this world, and the amount of compassion and dedication to accessibility is truly impressive. So with that, please take it away, Dr. Joe.
Oh, thank you, Sophie. I've learned a lot from Dr. J as well, as you have, and he's a terrific person. And we have a great partnership with Dr. Finney at DHHS as well, or newly retired at DHHS. And she retired about a month or so ago. And it's been a terrific journey. And, it was interesting because I think it was Megan that at UNH that has a program that she teaches physicians how to treat people with disabilities. And I learned from, the things that are common sense that you forget about when you leave practice. And I left about 25 years ago. I practiced for about 20 years, and I'm 70 years old, believe it or not. And so anyway, I practice quite a bit, and there's just things that you forget about that are common sense, and that I really learned a lot from Megan's program at UNH. And Tracy is terrific to work with. I've worked with her as well at Blue Cross Blue Shield of Massachusetts, and she's been a godsend because of her knowledge of the inner workings of DentaQuest. And basically what we've done is we hold the contract with DHHS and to administer the adult Medicaid program, but then we've subcontracted it out to some people that understand exactly how to work with Medicaid and with CMS, which is DentaQuest, and they're experts at it. And because we realized that we did not have the expertise involved and also the discipline to be able to manage that, because there's all sorts of requirements by CMS that we're not privy to or restricted by in the commercial world. And so that's part of the problem with DentaQuest, is that there's a lot of things that they can't do. And although Jay is really involved and his passion comes through, and so he's really working hard at this.
And Dr. Joe, I wanted to ask about your own journey to this cause and what makes you really drawn to work so hard for this.
Well, I had some patients that were really important to me, and there was one fella, his name was Chris Ortiz, I want to say, or Hernandez, but he was that we needed some help with this, or Jay needed some help with it.
That
So
is really great.
I think it's the patients that make a difference to me.
Mhm.
And I see Dr. Vachon on as well, and he's also a terrific provider. And I forget where he is exactly. I recognize the name though. And he's on a commercial business as well as Medicaid, and he does a lot of developmentally disabled people.
And what did like I think it would be really good for people early on in their career to really have these formative experience like Dr. J was saying. Is there a push to in schooling? I don't know how much you know about this, but in schooling to get people more sort of
Well,
exposed to these different.
they tend to deal with Medicaid people in the schools. And I
Mhm,
was the dean for clinical affairs at Columbia University before I came
mhm,
up here for my grandkids and to be around my grandkids or grandsons, I should say. Um, and one of them's playing baseball tonight with
oh,
Little League in Concord. But anyway, we we didn't really emphasize it as much as we should have, although we did have social workers in the clinic alongside the dentist, the dental
mhm,
students. And it was really interesting that people's lives are very difficult and complex,
mhm.
and when they're on Medicaid, and just getting the normal stuff is very difficult. And I don't think it was lost on some of the students in my mind.
And
And
I'll just
although I
add,
used to try to emphasize that to them.
so every dental school has to get accredited. I think it's every 7 years, and I can't remember the name of the body that accredits them, but essentially they every 7
CODA.
CODA. Every 7 years, dental schools are evaluated by CODA, and there's certain things they have to do so they can still give out dental licenses. And I believe as of 2020, every dental school has to have some type of program for their students where they are treating patients with disabilities. I went to Tufts Dental School over 10 years ago, and I had the experience there where we were able to treat people in clinics that Tufts owned. But now it is a requirement for every dental school in order to keep their accreditation that they have to teach this to their dental students. So, to Sophie, to your point, there is a growing emphasis on this, and many other aspects too of treating geriatric or elderly patients. There's all kinds of things that dental schools are putting a lot more focus on.
That's really great. And Jennifer, I had a question of, do CEIUs focus on that?
They do often. And
Okay, thank you.
the continuing education programs
Mhm,
are often dedicated to treating certain populations of people. And it's really not any different than treating the regular population, the commercial population.
mhm. Just to keep time in check. Let's move on to Kathy Bates, but thank you so much for all of your insight. And I just want to just move this um, along so we can get to questions at the end.
Yes.
Um,
And
Kath-
it's been a long haul to get the legislation, even though the governor wanted to sign it earlier, a couple of years earlier, but he just couldn't do it because of COVID-19 and all the budgetary restrictions that happened because of that. But it's a long time in coming, and it's very necessary. And we're one of 20 or so states that have almost no adult Medicaid programs, and something like roughly half of them do not have adult Medicaid benefit, and it's really a shame that it's like that.
Yeah. Yeah. Yeah, I have one more question, but I don't know if we want to go to Kathy, but I don't know if it's a quick one. But you a lot of our meetings that we've had together, you've done a really good job of kind of showcasing the perspective of dentists who might not be accepting Medicaid and kind of showcasing some of the worries that they might have in terms of if they can do it and reasons why. Yeah, so kind of thanks for that. I know we want to get to Kathy too, but I don't know if you want to take a minute to talk about that at all, kind of having that perspective of here's why someone isn't taking Medicaid and here's a difficulty a dentist might have.
Right.
That might be a Q&A question. Let's get all the panelists done first. Kathy, do you want to, I know you have some slides. Do you want us to set those up?
Sure, but I just wanted to take a minute and talk about the thing that we did, the disability health program. I work with Megan on this grant project, and I also work with a bunch of other people. And I don't know if you know, but so we did this training, and I have been pushing for the training for years, because when I was a kid, I did not get like dental care at all. Like, I didn't really get real dental care until I was like 12 years old. So that caused me to have a lot of problems. I mean, I even got my jaw rebuilt because I had gingivitis so bad. And I had a lot of abscesses and just a lot of incredible pain. And then I started getting decent dental care. And also the issue is that, I'm not saying my care is complicated, but I had a lot of friends whose physical care was very complicated. And so when that happens, sometimes the teeth are the last thing that the caregivers think about, and there's a lot of pain and a lot of illness because of that. So that's why I thought this training was so important. And also, people looking for jobs. You need a nice smile so you can. It's easier to impress people if you have a nice smile, and you can be more friendly. And because I really believe a smile goes a long way. So okay, you want to put up the slides?
Yeah. So just sort of summarizing those points of like healthcare, like if dental care isn't a piece of healthcare, then the people can just exactly what Jennifer said. Bad teeth can affect employment and can affect all aspects of a person's life. And I'm so sorry to hear about your childhood and having to get your job.
I had a dentist say, "Oh my God, you're disabled." And I go, "Was it the wheelchair that was supposed to go?" I was like, you know,
Yeah.
I just, you know, and I felt like I already waited 3 months for the appointment, and then they would be like, "I'm not a good enough dentist to work on somebody with a disability," and they'd send me away with my X-rays.
Yeah, that's, yeah, anyone would be honestly lucky and honored to work on you because you're so awesome. But I will leave you to present your slides.
This is not the whole thing or anything. I just wanted to give you a few basics so you know what to expect, and to kind of give you a preview. So this is just a preview.
Beautiful preview. Let's go.
Okay, next slide. I can't see the whole slide, but there are basically 4 goals. Be disability aware, work in partnership with patients. That means like assume confidence, like listen to me. I'll tell you what my issues are. Be a little more flexible. Oh, assume confidence is right there. Oh, I think that one should be right up top. Just saying. Okay. Oh, we did that one. I just did. Okay. What you can expect? Like I said, the training takes about an hour, but it's self-paced, you know. You can go slow. There's slides with statistics about dental care for people with disabilities and the usual slides, the kind of things that Megan loves. And there's interviews with Angela, the hygienist who normally works with patients who have disabilities. And there's lots of scenarios in the office, in real dental office. We were in Salem. Like my scenario has to do with X-rays and pursuing confidence. And then there's knowledge checks and evaluations, so people can get those. See, what do they call CCUs? I don't know. So they can get credit for it. Where's the pictures? Oh, here they are. Oh, so you might recognize some of these people. That's me and Amelia. There's Megan, and of course, you know, Alex and Katie. And that's Thomas, Geminino, and Angela Boyle, she was our hygienist, and she really is a hygienist. And Emma Ledger, she was a lot of fun too. I might be tried to pronounce the videographer's name, but we've worked with them before. And so there was a lot of different, you know, scenarios, and Angela and then things, and then also there's interviews, where people are talking about the challenges, for their access to dental care, you know, like transportation, or, you know, cost, or the fact that things may just take a little bit longer to, like, get in a chair, like myself, for instance. I have a headrest, and I can lean my chair back, so, you know, so I use my chair like a dental chair, and, like, I will be the first to admit that it's a little bit more challenging to work on my teeth because I have things like a gag reflex, or I swallow backwards, like some people with disabilities do. So, you know, so this thing, I might tackle those things. I mean, and it does take a little bit longer for people to get comfortable in a dental office. Alright, so what can you do? If you have a dentist or a hygienist, you can take this training, of course. And if you have a dentist, it would be good if you let them know about this training. I think it will be fun also, because there's a lot of different situations, and you know, they're never too long and not usually boring. It's not lecture at all. And that's it.
Wonderful. Megan, do you have anything to add? I know you put the link in the chat for the training.
Oh, thank you.
No, that was great, Kathy. Thank you so much. Yeah, I put the link in there because Kathy and I were talking about this earlier this month, and we had the URL saved, but it was just this afternoon that it went live. So
just this afternoon?
yeah, so we're excited about that. So this is for dentists and dental hygienists. So not really for the general public so much, but if you know it, you know, if you're going to the dentist, someone on our team created these great little kind of postcards that are bigger than a postcard, but it's like a little half-size flyer for
I haven't
people
seen it.
I just hot off the presses, Kathy. The next time you come in the office, I'll put one on your desk. So we have these that will we will plan to share with the New Hampshire Dental Society, the New Hampshire Oral Health Coalition. So we're going to go out through those avenues. But if anybody else is interested and maybe would like some flyers or have an event coming up they think it would be helpful if we came to or wanted to share flyers, we would love to hear about it. Oral surgeons, I mean, I think would be relevant for anybody who works in oral health more generally. We are offering one CEU credit or CE credits. I don't always know the lingo, and I don't know how enticing that is to have like a 1 hour credit. But yeah, that HTI dental hygienist program. So we are thinking and working on a marketing outreach now as our next steps. But just no one's taken it yet. So if anybody would like to take, is affiliated with the dentist and would like to take it and wants to give us some input, we'd welcome that. But yeah, just really excited to share that with you all because we've appreciated your input on this along the way.
Actually, Megan, I'm going to an event, which I know the caregiver conference in Concord. Maybe you want to have a table there.
Yeah,
I'm going to be representing the DD Council. I don't think there's going to be any dentists there, though.
Yeah, that's the only
but
thing.
Not dentists.
We considered that as well. And right. Thanks, Kelly. I appreciate that. We have some things that are going to that event, but we're trying to think more about around like health professional activities where we might encounter dentists, but that's a good one. And I think the IOD will be there.
I guess I'll say hi then.
Yeah.
Can I just tell them about this? This for the heck of it. This is something that everyone can watch. I just saw an hour show in Hulu, sponsored by Sensodyne. What
Oh,
was
yeah.
it called? Did you see it yet?
I didn't. It's still in my list, Kathy. Let me look up the name of the it's not a documentary. It's a documentary.
It is a documentary.
Yeah,
And they
but it's
talk
good.
about sensory friendly spaces.
Yeah.
And I'm in love with the dentist on that. And I'm like, because he's such, and it's just everything we talk about, they talk about. So it's really cool.
I'm gonna
So
look up the
guess
name
what
of
I'm
it.
talking.
Yeah, I took a screenshot of it when you told me about it, and I'm just looking for it now.
And I just wanted to add, Megan and Kathy, thank you so much for this. I know it's crazy it's here because I think it was 2 years ago that I met everyone from UNH, and it's so great that we have something for dentists. So I'll probably send you both an email, but we're more than happy to share this now that it's live with everyone who's in
Cool.
the Medicaid network. And I can assure you, 1 hour of free CEU, it is enticing, especially everyone's 40 hours are due in March, so it's coming up
Okay.
quick. So yeah, I think it really is enticing, and maybe we could even send it again once we know that everyone's 40 CEUs every 2 years is coming up. So thank you guys
Yeah.
for your work.
What is that thing called?
The documentary is called Sensory Overload, and it's on Hulu if you have Hulu.
It's so good, you guys. You have
Maybe
to
my
watch
sister
it.
will watch it. I don't have Hulu. I have cable though.
Yeah, it's sponsored by Sensodyne, but it really goes into sort of all these issues that we talk about. And so Kathy and I started looking into if it'd be possible to host like a watch party for people who are interested, and I haven't figured that out yet. It looks like you might have to still have a subscription. So there's too many streaming platforms. So we'll see what we can find out, but that might be kind of a cool thing that we could maybe do at a future meeting.
Yeah, it'd be fun.
All right.
love-
We're gonna give our people a little 5-minute break. Uh, gather their thoughts, and then there'll be a quick Q&A after the 5-minute break. Do you think that's good, Colby? Just like a 5 or a few minute break?
Yeah, a couple minute break if kind of to think of any questions. Yeah, I think that's fine. Couple minute break, and then I know people might have stuff after, but if we come back with a few questions, I think that's fine.
Yeah, that would be really great. So yeah, let's come back in like maybe 3-5 minutes.
Yeah.
Whenever people are ready, just to have people think of questions. Awesome.
That was quick, but I was okay.
That was awesome, Kathy.
Okay.
I loved it.
Megan, I found it, or somebody found it for me. My ass, Kathy.
I'm so glad. Kathy had a computer issue. She thought she lost her files that she'd been working on all week. I'm so glad, Kathy. I've had that happen to me before, so yay, I knew you'd recover it somehow.
I'm really glad because I didn't want to. Like I have one hand and nobody's doing with my computer.
Thank the computer gods.
Yes, I always thank the computer gods.
Again, you may want to check YouTube for it on who, because I know Netflix often will post their documentaries on full on YouTube, so Hulu might too.
Good point. Yeah, we'll definitely check. And maybe if it's not right now, it might be like next month when their license expires with Hulu or something. So I haven't even seen it yet, but Kathy mentioned it and the description looks spot on. And it's not super long either. So
Yeah, I like documentaries myself. I actually went to the Family Support Conference and they did The Ride Ahead, which is a documentary. I'd seen it in Concord at the movie theater. So I kind of didn't really have to see it again because that was my shift after lunch as the brand ambassador for Stop Special, just to answer people's questions and that sort of thing, if anybody came by the table. But they were all watching the movies, so not that many people came by the table. So it was kind of an easy shift, I guess you could say. But like I said, I'm going to the I went to the Family Support Conference. I'm going to the Caregiver Conference. I didn't want to go to, they're having something in Portsmouth, a Pride thing, but I'm like, but that's really far for me to go. Because I have to go in Uber or Lyft, and then it's an outdoor event. And I'm like, I'm not an outdoor person.
I know.
Megan's the outdoor person.
The closer one for you. That might be a better fit.
Which one?
For
Concord is closer than Portsmouth. I know that much.
yeah, I know, but what I was saying, since you were gonna go to a Pride event in Portsmouth, I was assuming
No,
you
I'm
meant
not.
Portsmouth Pride. Okay.
Yeah, because it's an outdoor event, and my sister Sean had skin cancer last year, and I'm very pale. My cousin actually had gotten skin cancer too. He died from it. So I'm like, no, we're not going outside. We're gonna be in November indoors. It's at the Grafoni Center, I found out, and that's where the Family Sport Conference was. So I'm like, oh, good. That's a nice facility, I think. I hate the hotel, but it's a nice facility for a conference.
Air conditioned.
Yeah, that too. But in November,
I'm sure they will be.
it'll be
we're-
heated. I hate heat.
I'm sure.
Oh
I'm
yeah.
sure
yeah.
there'll be other events too that are Pride
Actually,
events that
not
will
that I
be
know of.
indoors.
I'm not that I know of before November though.
Okay. Well,
That
if
the
you
DD
want, I
it
can
has to be
for.
somewhere that the DD Council has a table at, so that I'm restricted that sense.
Well, if I think of events that might work for DD Council, I'll pass them forward.
Sure.
One thing.
It's gonna be
I
hot
want-
tomorrow.
Yes. I see a few people dropped off. We're down to 14 participants. That's fine.
All right, but I do think for our participants we should start the Q&A. Does anybody have any questions to start us off?
Yeah.
I do.
Okay.
I have a question that was emailed to me that I'd like to read.
Oh, okay.
Since we're recording this, and then this person can then watch the video on her own time. So it says many pediatric dentists are discharging children with Medicaid at age 18. Adult dental coverage doesn't begin until age 21. There is a 3-year gap in services I have dealt with. Luckily, after Exeter Hospital sold to Leahy, our dentist went private and agreed to see my son several more times before his 21st birthday. Our dentists didn't catch this discrepancy. How can we make sure pediatric dentists are treating until the day before age 21?
I don't have an answer to that.
Yeah.
I grew up in Illinois and I actually lost my dental coverage at 18, but I think I lost it, but then I went to work full time because I was in a foster home my senior year of high school, so I had to go to work full time, and that's how I got my dental benefit, was through working. And I remember running out of my dental benefit for the year, like usually in March, and they knew that I was working, so they just had me on a payment plan type thing. I don't know, I have an answer for how you can't really force a dentist to take it beyond a certain age or anything like that I know of.
But that was in Illinois. It doesn't really answer for New Hampshire.
Right. That's why I say I don't actually.
Yeah.
I don't have.
That could be a question for the DRC, and we could pass that along. Yeah, I do think there are some circumstances and some exceptions in a lot of this legislation, such as big expensive surgeries or things that aren't just regular checkups that can slip through the cracks. Do like especially like anyone of our panelists or anyone even who's just attending have any advice for either advocating for those who are slip and shining a light on those cracks and those people who are being left behind, or what is being done for those people who are being left behind?
Yeah. I was just going to say, as someone who's only, interacts with the adult Medicaid program, I actually wasn't aware of the gap because we don't administer the child program. But I would think that's just how it's legislated. So it would be that advocating to the legislature in New Hampshire, and working with the advocacy groups like the Oral Health Coalition and just making your voice heard. That's how that change comes about is by talking to the legislators.
Yeah, I would say I never understood why it doesn't kick in until you're 21, because what if you're just not developmentally disabled and 18 and you're not on your parents' coverage? You have to either go to work full time to get an employer benefit, or you have to go without forever, I guess. I don't.
Yeah. Most adult programs, different states, it starts at 21, but sometimes the children program goes up to 21. So it's all about how it's legislated by the state.
I also want to let everybody know that I put in the chat a list of additional resources if anybody wants to contact anybody else. And also the one pager that the Oral Health Task Force did for dentists, for providers to use to work with the disability community when providing services. And if anybody has any additional questions about those, definitely reach out to me and I'll be able to answer them for you.
Yeah, could you send me that by email? Because if I jump off onto the chat, I might go into the bit bucket of the internet universe.
I will.
We have a question in the chat from Jennifer. Why are dentures only covered for certain populations under New Hampshire Medicaid?
I can answer that. That's a question I answer a lot. And again, it's because of how it was legislated. When to get this bill passed, there's two different subgroups, those who have a qualified waiver. And I'm trying to remember these waivers offhand, but I know one is an acquired brain injury. Another is if you're in a long-term care facility or a nursing facility, they qualify for the denture, where the general population does not. And it's just the way it was legislated, the way it was budgeted, the way it got funding. I know from my personal experience, I did thousands of dentures, and it wasn't necessarily people in nursing facilities always. I've done dentures for people in their 20s, people who were recovering from opioid addiction, people who have just never seen the dentist and didn't have the tools to take care of their teeth. So, it's not just people in long-term care facilities or in nursing homes, but that's one of those things. It's the way it's legislated, and whenever there's the opportunity to go back to the legislature and say, here's what the experience of Medicaid patients are, and also the feedback from Medicaid dentists, and share that feedback, that it can only change through the legislation.
No, yeah, true.
The
Thank you.
waivers that Dr. J referred to are members with developmental disabilities and acquired brain disorder fall under the Choices for Independence program or our nursing facility residents.
Thanks, Tracy.
One thing.
I think that's correct me if I'm wrong, 13% of the total Medicaid population.
That's exactly right. It's 13%.
So it's a small amount of people who qualify.
That's too bad, but what can you do, I guess? Just have to hope that we can amend it one day.
Right. And if Dr. Finney was here, she would say, that's what it took to get the bill across the finish line, so that we had at least some comprehensive coverage. So it's a step in the right direction to get the benefit. And then, as I mentioned earlier, there's lots of people working to continuously expanding this benefit, and those things take time.
Sometimes with bills, you have to kind of do it slowly. Pretty much, have to just add on to it slowly, or then people will probably panic and stuff. So.
All right,
Thank
any
you.
other questions?
Yeah, one thing I want to kind of bring attention to is some of the reasons that there are obviously barriers, and some of them we've talked about a little bit, where sometimes people with Medicaid will have trouble getting transportation to the dentist, or they might have trouble making that appointment. They might go a while just because they um, might not have the resources to make an appointment by themselves or have someone else make the appointment. So I kind of want to bring to light a little bit of that and kind of some of the unfortunate barriers that people on Medicaid face when it even kind of barriers they face before they even step foot in the dentist. And I feel like Dr. J and Joe, you both done a really good job at kind of talking about that side of it and some of those barriers. And I think all of us have done a really good job of acknowledging the barriers and finding ways to um, educate. So, yeah, is there any advice for some people who maybe don't have transportation or um, maybe don't have the ability to make a phone call to schedule an appointment or kind of stuff like that? Some of those barriers before one even steps into the dentist.
Sure. Yeah. So, I mean, we just talked about, the dentures were not something that were added, but one thing that DHHS fought very hard to have included was a transportation benefit for all Medicaid recipients. So we do have a transportation vendor that if you're, a DentaQuest, a Medicaid patient, you're able to contact them and get transportation set up to get to your appointment. And I'm sure we could send some information out, there things about, you want to at least try to book at least 2 weeks in advance. And if you have to cancel, giving them enough notice, things like that. But there is a transportation benefit for every single Medicaid eligible individual. And then you had brought up the point of, there's there's more barriers to care than just not being able to find a dentist. There's other things about not being able to pick up the phone and call that provider, or not knowing what to say because it's been so long, or there's a whole bunch of other things. So one of the things that we do, as I mentioned, care management and our care coordinators. And what happens is when you get your welcome packet as a Medicaid recipient, you fill out a risk assessment, and in that risk assessment, you talk about it asks questions about what are your barriers to care? Is it food insecurity? Is it transportation? Is it, not having other resources, or, the ability to make these phone calls? You put those things on the risk assessment, and that goes back to our care coordination team. And then our care coordination team is actually able to work with people to help them try to overcome these barriers and get treatment. And just as an example, one of the things our care coordinator in New Hampshire that some of you might have already met, her name's Tori, and she's fantastic. Oftentimes, she'll do a three-way call with the patient, herself, and the office, and she can help, kind of bridge that gap of talking to that provider and getting you in for that appointment. Or if you're having difficulty finding a provider you're comfortable with, she's there to do that as well. One of the other things that we developed together, DentaQuest, Northeast Delta Dental, and ABLE, the task force, is a script for people who I don't know what to do when I call the dentist. It's been so long since I saw the dentist. I don't know how to tell them about my benefits, or how to ask for the appointment that I need. So we worked together. This was probably six months or so ago. I think it was right before the end of the year, where we developed a script that could be used. And I know that was emailed to Lewis and Kristen, and it's something that we could certainly share if anyone feels like they could benefit from that script of here's what I can do to call the dentist. Here's some of the questions I might want to ask, and here's some of the things I might want to try to find out beforehand. So that's something that we worked on together with the ABLE task force.
And if I could chime in as well, this is Megan, thinking about the other end and how we could let dentists be a little bit more understand some of these broader circumstances. Because Colby, that's something that we heard a lot in this task force. And when we talked to people as background work for the training we made for dental providers, And, Kathy mentioned some of the 4 main things you were trying to get dental providers to leave the training with. And one was to adopt this perspective of trying to be flexible with patients, because we recognize that, if you're running a dental practice, you're running a business. And if you might have policies that say if someone doesn't show up for their appointment, they're charged the full amount. Or if you cancel your appointment or a no-show twice, you're off our list or whatever. I know when I first moved here, my dentist only took new patients on Fridays at 12. It was just like their policy. And it was like kind of hard for me, but I really wanted to get in. And so we use this opportunity to introduce like some of these other factors that happen outside of the office, to say before someone even gets in, there are circumstances that might be sort of like the policy level that, affects their access to care, the neighborhood, right? Where the bus stop is, if they have to take public
Whether or
transportation.
not they put them in garage and get them on a bed.
Right. Availability of personal care. So just giving them this sort of background context to consider, so that, as a person who administrates the programs, to say, all right, if someone cancels on me, like, wow, like that's an extenuating circumstance that I can accept and maybe change my office policy. So that, I feel like that's, an example that tries to kind of get at that. The flexible, being flexible also kind of refers to other aspects of care, but I think it really gets at what you were talking about, Colby. And it was a hard thing for us to try to fit into the training, because it's not really something that a dentist should have to do. Like, it's not their job to try to fix the Medicaid policy or to change where the bus stop is, but just to consider it. Like, what did it take for this person to try to get in the front door today? And this comes up a lot in the context of people with disabilities, and like how travel longer to get to places, rely on more people to even to try to find transportation. So the transportation thing itself ended up being really huge, and we tried to fit it in that way. So I really like all the work that this group has done, like Dr. J was saying, about trying to equip the public and giving them resources. But as we were preparing this, we were also thinking, what can we let the dental providers know about that background piece, so that it might help them in some ways try to be responsive to their patients' needs. But thanks for bringing that up, because I think it's super relevant.
For sure, thank you.
I think a care manager would be helpful. I have a care manager because I have heart disease, and I don't really have a care manager because of my dental stuff. But they are helpful because she's actually a nurse, and I talked to her, and she's like, "Oh, call me if you need anything," and that sort of thing. So it's helpful to have a care manager, maybe to help you through like other people were saying, like, what do I say when I call the dentist? Because I've been on my own, living in my own apartment since I was 18, and I'm 58 now, so I'm used to calling the dentist and saying, hey, my tooth hurts or this or that, and getting to the dentist and try to get in as soon as possible if you have.
Owen, you have your hand raised?
Just double checking with my audio.
You need to put your headphones on. You're cutting out without them on.
Okay, can you hear me?
Yeah.
Yeah.
Okay. With me, I was kind of also gonna piggyback a little bit on what Colby was talking about in terms of that. I just had an aha listening to it, that I was wondering if the training Megan, you were doing, also included the secretaries, because I know that having a really good secretary when you're first starting out and establishing care and having someone who's patient with you is like really key in terms of a welcoming piece. And I think that even before you get into the dental aspects of it.
You mean the receptionist?
Yeah, receptionists. Yeah.
Yeah, Kathy, do you want to say something, Kathy, about the old communications module?
I had when I first went to my current dentist's office, I was sitting in the waiting room with the woman that drove me to the appointment, and And the receptionist goes over to her and says, and after the paper, she's like, I assume you're gonna fill this out for her. She doesn't even look at me, doesn't acknowledge me in it anyway. And so I look at my place who wrote me in. I said, I think I need to do a little education. So I said, I tapped it on the shoulder, like I tapped it on, and said, excuse me, I'm the patient. You need to be addressing me. And I believe I asked if we could send the paperwork to my home so I could fill them out at my house. She is just my driver. She knows nothing about my medical history, and you can't make those kind of assumptions. And then I look at the paper, and it's like really, really small, and there's no room to write anything. And I'm like, and this paperwork isn't even accessible in the first place. And I said, but I will take these home and do my best to answer. And, you know, but I'm like, you can't just go handing my paperwork off to anybody and say, I assume you're filling this out for her, and not even acknowledge me. And I was very, very upset. But we worked it out. I wrote a letter and said, do you know what I do for work? And I explained everything about what I do and how I help design programs, public health programs, and trainings. And I wrote everything down that was offensive to me. And everybody was much nicer after they got my letter. And I was nice and professional, but I was very, very upset.
Yeah, and I think, Kathy shared some of that story in the I think we used some of it in the training for dentists. And I think the thing is, Owen, we were thinking that it would be I think this came up. We have a separate training that we did for physicians and nurses, which sort of inspired this work. And we have a supplementary one that's focused mainly on communicating with patients. That we were really, as we talk to healthcare providers more generally, that we would say, and your front office staff would probably benefit from this shorter half-hour training. I think obviously, we say that we have these continuing education credits as motivators for people who work in healthcare, and the front desk staff don't have those same requirements, so that's not as much a motivator. But it might be if their provider says, I want you to take this training, or I think it would be good professional development. So we do think it would be appropriate for front desk staff. And if they wanted a shorter version, we have this other training that might be geared towards them.
No, I think that's good. I also was kind of curious, Jay, in terms of because I know with having ADHD and, habit making is a very hard thing, and dental hygiene is nothing but habits in terms of outside the dental office. And so I wonder how your approach is in terms of making sure you kind of get that sort of ability for people to create healthy routines with that when creating routines is difficult.
Yeah, that's a great question. The first thing that comes to mind is in my practice, I always tried to make it fun so it didn't feel like a habit. Um, it's kind of crazy the different things that go along with toothbrushes now. Like if you buy an electric toothbrush, Sometimes it will buzz every 30 seconds, so oh, move over to the next, side. There are some that come with timers that have a smiley face once you've hit the amount of time you're supposed to be doing it. Um, there's also a lot of things that they're kind of more accessible now, bigger handles for people that might have issues with fine motor skills, things like that. One thing I'll try to find, I know DentaQuest, one thing they do is they say you want to brush for 2 minutes. 2 minutes is a long time when you're trying to focus on that. So DentaQuest even made a playlist of 2-minute songs. So you can find a song that you like, it's 2 minutes, and when the song's over, that's when you stop brushing. So there's all kinds of ways to make it fun. I went to an event with Northeast Delta Dental, and you guys gave out those uh, sand timers where you flip it over, and it takes 2 minutes for the sand. So that's another fun thing. So there's definitely lots of different kind of fun ways where you think this isn't a habit of something I'm supposed to be doing for the dentist. This is something fun for me, you know. So that's the first thing that comes to mind. But I mean, habits are hard for everyone. It's hard for me. I've got a whole bunch of books back here about making habits and sticking to them, and I struggle with that as well sometimes. So I think it's about making it fun.
All right, any last questions to finish this off with?
I have one.
Yeah, go for it, Kathy.
Oh, can I write to tell them that they allow me to flip top to basic? I like Colgate only. Colgate is my favorite toothpaste because they have flip top covers, and that means I can brush my teeth whenever I want to. So who do I write to and say you all need flip tops?
I'm not in
Does
marketing,
anyone know
Kathy. I
that?
can't help you there, but it's a good idea because otherwise you have to screw it on. That's like a fine motor skill to get the thing back on or not to get too much out at the
And
same
then I
time.
drop the
So it's
cover, and then the toothpaste just all grows on top.
I was just thinking that, Kathy, when it gets crusty, it's hard to put it back on it. Yep. So I like that, flip tops.
The Colgate always has flip tops. It might not be the best toothpaste, but it's the best as far as accessibility. So who do I write to?
Awesome. Well, I just wanted to thank all of our
I'm
wonderful
sorry, we can help you
panelists.
with that, Kathy. I'll reach out and we'll do like some
Okay.
kind of a writing campaign so we can get more accessible
Okay.
toothpaste lids.
Awesome. I just
Okay,
want
thank
to,
you.
well, Mara Blanco from Gateway said, thank you so much for this wonderful presentation. It was very informative and very appreciated. I hope everyone has a great evening, which is a wonderful thing. I just want to thank our wonderful panelists. It's been amazing working with you all, and this has been just a really long time coming. And I also want to thank Kristen and Katie for being the chairs of this task force and really seeing this idea and being like, we need to make this happen. And absolutely a thank you to my co-host Colby, who has just been really strong and working hard from this idea. So I just
thank you for having us, having me, I guess I should say.
And thank you,
course.
Sophie, for doing such a great job hosting. Same with you, Colby. Really appreciate it.
Awesome.
You guys did an excellent job. Everybody
Thank you
did.
all for your time.
Thanks.
Bye, everyone.
Bye-bye.
Bye.
Bye.
Thank you.
Bye.
Thank you.
Eve.
Mentally retarded person, and he was intellectually disabled, and we found a way to get him into the chair for cleanings, and we had to sedate him to do any bigger work on him, but he was a terrific person and just a real joy to me. And so that's kind of the reason I was drawn to this when it became apparent that we needed some help with this, or Jay needed some help with it.
That
So I
is
think
really great.
I think it's the patients that make a difference to me.
Mhm.
And I see Dr. Vachon on as well, and he's also a terrific provider. And I forget where he